We are Group 6. I will introduce my group members. The first, Kelvin Angling Kusumo as a speaker 1. The second, Septaviana Dajihan Asar as a speaker 2. The third, Wahida Gusmiasari as a speaker 3. And the last one, Wahyuni Dakonita as a speaker 4. We will present an ethical decision.
The first is ethical problem. Ethical principle. What are the ethical principles involved? It is automatic and veracity. Number two is ethical issue. What are the types of the ethical issue happened? It is empirical knowledge versus problem beliefs. Number three, problem statements. What are the problems? Number one, so the nurse complied with the decision of the hostage parent not to cry out the blood transfusion product without recording of the patient fear of death. Number two, does the patient have the right to make choice for himself that may result in harm, or can the nurse take control, and what benefit both her and the patient?
Data gathering. Relevant facts. What are the facts gathered from the case? First, surgery is required and the surgeons believe it likely that a blood transfusion will be required during the operation. And then Sandra's parents make it clear that they are unwilling to give their consent to any procedure which involves giving her blood product. Stakeholders and the concerns who are involved. What do they concern is stakeholders. Patient. Sandra tells that she is very scared to dying and wants to do whatever is best for him. Surgeons. Surgery is required and the surgeons believe it likely that a blood transfusion will be required during the operation. Concerns. Sandra's parents make it clear that they are unwilling to give their consent to any procedure which involves giving her blood product because their belief does not legalize that kind of procedure.
Option. What are the possible solutions? What are the advantages and disadvantages of each option? Option 1. The nurse will ignore the necessary blood transfusion during surgery because the patient's parents refuse. Advantages. The nurse followed the patient's family refusal, and there were no cases because the nurse insisted on having a blood transfusion without the patient's family consent. Disadvantages. The patient will be short of blood during surgery. The nurse gets the consequences for not following the rules or procedures that must be done. Option 2. The nurse does what the surgeon recommends by performing a blood transfusion during the operation. Advantages. Patients get the best treatment. Disadvantages. The nurse takes action by ignoring rejection from the patient's family. Option 3. The nurse educates the patient's family and tells him that his child agrees with whatever course of action is best for him. Advantages. The patient's family will be educated and agree on what action to take. Disadvantages. The patient is operated off pending approval from the family.
Decision and justification. Decision. What is the recommended decision? The nurse should choose opinion 3. Justification. What are the considerations the nurse should take into consideration? All the patient family opinions would still put the patient first. Patient agrees with whatever courses of action is best for him. Nurse should give education to the patient family about the importance blood transfusion, because if the patient does not get a blood transfusion, it is afraid that the patient will lack blood during the operation later.
That's all for our presentation. Thank you for your attention.